Hey, this is Stephanie from Dallas, owner of Techstar Physical Therapy and one of your Health Made Simple pros. So today I thought I'd talk about injections. And before we go into injections and why they work, why they don't work, and why they kind of wear off, let's go into how we feel pain. So there's really three ways that we feel pain. We feel pain thermal, there's chemical pain, and there is mechanical pain. And so let's go into thermal pain. Thermal pain is just like burns, sunburns, those kind of things. Mechanical pain are the mechanics. So it's the mechanics of the way we move. There's something mechanical going on, and that's what physical therapy really can help. And then there's chemical pain. And chemical pain is like after you have an injury, you have inflammation, swelling. Those are chemicals. And so what happens with injections sometimes is we are doing injections and maybe there's mechanical pain, and chemicals treat chemicals. So if you have inflammation or you're hurting all the time and chemicals are involved, then the injections will work. So let's go and give you a differentiate between chemical and mechanical, because that's really what we're talking about. So chemical are things that, that brings inflammation on. It's something that happens and it hurts all the time. It's that not chronic, but it's that low level achiness that you feel all the time. Positions and movements don't necessarily make it better or worse. So that's really what chemical pain is. Mechanical pain can be constant pain, but it also can be intermittent pain. So it's something that's going on mechanically. So the questions that I usually ask to really differentiate between the two is, do you feel your pain all the time? If you feel your pain all the time, well then, they could have a chemical problem going on, but they also could have a mechanical problem going on. But if they say, you know what, it comes and goes, then we pretty much can identify that there is a problem mechanically, because the chemicals don't just come and go. Mechanics of you changing your body position and making it worse, or doing something and making it worse, or doing something and making it better, that's something that physical therapy really can fix. And so if you also ask, can you change and move and make your pain worse or make it better? Those are also mechanics. We're asking questions to see how the body responds within certain situations. And so if you go and you have someone with a mechanical problem and you give them injection, it's not going to work, because you've got to change the mechanics, and that's when you need to come in and look for physical therapy. But if you have someone that has constant pain and from a physical therapy standpoint, we can't, reduce it, they may actually benefit from having an injection. But too many times we just go and we just give people injections, let's see what happens, and they don't even have therapy. What does the research say about that? I mean, if you look at what the research says, and I was shocked by this when I was going through the McKinsey program, is that research after research was showing that if you just go and you give people injections that have pain, 6 months down the road, they may feel better initially than just exercising, but 6 months down the road, the pain typically comes back again. And the people that actually just exercise, just general exercise, actually end up doing better in the long run. So it's why if you're going to have an injection, you definitely need to come in and see a physical therapist so that we can really teach you what's going on, why you're having this, so that we can really fix that problem, even if there is a chemical and a mechanical problem that's going on. And if you do have pain that's intermittent, that comes and goes, that you can change your position and make it better and worse, maybe you think about just starting with physical therapy and not going down that road to having an injection. So this is just some of the things that that I've learned from just doing a lot of research and reading a lot of information that I share with my patients. I thought I would share it with you guys. Again, if you have any questions or anything that you want to learn a little bit more about, please get with me, share with me any information that you want to learn, and I will find that information out for you and get it out to you. So feel free to share this, and I will see you guys later.